Okay, we're about ready to begin. Looks like this is going to be a very popular topic because we have a lot of people on this call. I'm not going to take any questions in this forum or answer any chats. So, welcome to another in the series of Wood Miller Explains Medicare. This one is specifically designed for Medicare Advantage plans, and it's designed to be a simple guide for you. There are deeper dives. This is designed more for people that either are evaluating an Advantage plan or on an Advantage plan, and is not an endorsement of any kind. So, let's get going. First of all, same disclaimer, it's typical first question is why is there Medicare presentations on a woodworkers channel? Well, one of the things that we discovered is as we were doing presentations on things like router bits and table saws, is a lot of woodworkers are 65 or older and either on Medicare or getting ready to enter Medicare or under 65 and disabled and on Medicare. Now, ironically, I also am a licensed Medicare agent. Now, I don't actively practice. I do help an agency during open enrollment, but I don't sell plans and I don't solicit business. So I'm giving you the real. So everything we talk about is for educational purposes, not designed to solicit business. It's all publicly available information and for illustrative purposes. This presentation is to take some of the confusion out of Advantage plans. And excuse my pun I use every time, but let's kind of cut through the confusion on Medicare. And this one is specifically designed to talk about Advantage plans. It's not an endorsement of Advantage plans. It's not a deep dive. There are other presentations we have that you'll see listed at the bottom on drug plans and Medicare 101. This is specifically about somebody who's on an Advantage plan, is contemplating their plan, or may have a few questions, or maybe wants to make some type of a change. So let's go ahead and talk about what is an Advantage plan. So Medicare Advantage plans are known as Part C. And it's kind of funny because now with all these TV ads, you hear about all these free benefits and a Part C. And I get calls all the time about this. Well, a Part C is an Advantage plan. So an Advantage plan, what it attempts to do is augment original Medicare. It's a private insurance company that becomes the primary and Medicare becomes a secondary. And it provides an alternative to original Medicare Part A and B. Now, here's some key points. First of all, Advantage plans typically cover all the services original Medicare covers and also oftentimes has additional benefits like dental, vision, hearing, as well as fitness programs. It's a network system. There are HMOs and PPOs, but you operate inside of a network of doctors, and I'll get into that in a little bit. Typically, though, while you still pay your Part B premium, Advantage plans have a different cost structure. It's kind of pay as you need it. I consider it that way, including premiums, deductibles, and co-payments and out-of-pocket maximums. Typically, it includes your prescription plan, Part D prescriptions, and there are a few different types of Advantage plans. The two I'm going to talk about today are HMOs and PPOs. We'll talk a little bit about special needs programs and also the fact that there's an annual enrollment period where you can make changes to your Advantage plan. So overall, Medicare plans, they offer a comprehensive way to receive healthcare coverage, but it's different and each person's situation may be different. So let's look at how we would evaluate this. So I approach this as though I was looking at an Advantage plan myself. What are some things I would look at? Well, first of all, what I did is I went to www.medicare.gov and got a comparison of three plans. And I did a summary of each side by side. I blocked them out because I'm not making endorsements of plans or want to infer that I am. I'd rather talk through if you're looking at a comparison, what are the things you'd look at? So in this case, all three of these are HMOs. They have a $0 monthly premium and include drug coverage. So the very first thing I would look at is the star rating. Now this one doesn't have them, but what it would do is it would be somewhere between 1 star and 5 stars. So you see that in the lower left-hand corner. 1 is very poor, 5 is excellent. I typically would not look at a plan that was 3 star or below if there's 4 and 5 star plans within the network, because what it does is it's sort of a quality assessment. It's a rating to help beneficiaries understand different plans based on quality metrics. And it's very good information. So they look at quality of care, customer service, member complaints, access to care, and preventable services. So the overall star rating is a combination of all of those. So in general, if it was me, I would look at 4-star and 5-star plans. The next thing that I think is very important about, and I sort of preach this a lot, is what I call a MOOP, maximum out of pocket. In this case, they call it maximum you pay for health services, but the technical term is MOOP. And I call it hit by a bus. So that's the best way to view it. So if you have a really, really bad year and you have a lot of medical procedures, hospitalizations, what is the most I would pay in a calendar year in eligible medical expenses out of pocket before the plan would pick up the rest? So you see, the three plans that I compared here, there's a pretty decent swing. One is as low as $3,300 total MOOP, maximum out of pocket. One is $5,900. I've seen them as low as 3,000. I've seen them as high as $9,000. Now, that's not the only thing I would base my plan choice on. Sometimes having a higher maximum out of pocket but better other benefits are okay. This is sort of your stopgap. It's your safety net. So you have a really bad year. That's why I say hit by a bus. What's the most I would pay in a calendar year for eligible medical expenses before the plan picks up the rest? Then you start looking at some of the basics. So almost all plans has a $0 copay for your primary care doctor's visits. Now, this is doctors inside of your network. If you had a PPO and you went to a primary care outside of your network, there may be a slight copay, but they try to encourage wellness and care and wellness visits. So it's $0 for primary care. I would then look at specialist visits. So that can vary too if you have a PPO, which I'm going to talk about in a minute, where you can go out of network. It may have a slightly higher specialist copay. The plan in the center has $0 for specialists, but the average is 25 to $45 for a specialist visit. And then there's another of procedures, labs, hospitalizations, and that's not the purpose of this presentation. So those are covered in other presentations. But for now, I would look at, is my doctor in my network? Is my specialist in my network? And how much am I going to pay there? Then the next piece that's really important is compare your drug costs. There's another presentation we have specifically on drug costs and drug plans. We have a demo on how to use Medicare.gov to evaluate your prescription costs. What I did is I went to Medicare.gov and I picked a number of medications. And this is important because, first of all, there's been some significant changes in the way Medicare operates for drug coverage. So there can be a big swing in medications depending on the plan you're on. And this is not the presentation for it, but each drug plan must have at least a minimum coverage that Medicare mandates, Centers for Medicare mandates, but the way that they treat the drug, they use a tier system and a formulary where they put it can make a big swing in the amount you would pay for various medications. So here's Plan A. This is actually a real plan and real medications compared to Plan B. And you'll notice same medications. I picked those. Those aren't mine, by the way. I just picked them because I know that they sometimes change from plan to plan. And if you look at it, the difference between plan A and plan B, same medication, has a delta in a year of $253.42. Now, I've seen some dramatic swings depending on the medication and the tier. I've seen some very high swings. So it's important to know how much your medications are going to cost inside of the plan that you're considering. I would, again, highly encourage you to check out our other videos that cover this topic. Another area you want to look at is the extras. That's what you always hear about. So in this case, it's the three plans and they list what it does have and what it doesn't have. But in general, there's a few biggies. So let's talk about some of those. Typically, an Advantage plan comes with additional benefits not offered by original Medicare. Typically, it has vision coverage for routine eye exams, glasses, and contact allowance, dental services. Usually, it includes routine checkups, cleanings, and sometimes more extensive dental work. Some plans have discounts or coverage for hearing exams or hearing aids. Uh, Wellness programs. You hear about silver sneakers a lot. Some have different gym member access. fitness classes or wellness coaching, transportation services, rides to medical appointments, over the counter. That's what that OTC is, over the counter benefit. That's a really cool one, and it depends from plan to plan, but typically there's a quarterly allowance that you can use for things like vitamins, bandages, even things like medical scales. And it's a use it or lose it. So each quarter they give you an amount of money that you can go get these types of things and stock up on them. Sometimes they offer home meal delivery for chronic care needs or after surgeries. And then there are chronic disease plans as well. So you need to understand what some of the common extras are. Sometimes they actually include travel benefits. I have that in another presentation as well. So think about your common extras. Now, we were talking about the different types of plans because an Advantage plan utilizes a series of networks. There's an HMO and a PPO. So typically, HMOs, you operate within your network of doctors and hospitals. So that's the first thing I told you to look at is your doctor and specialist in whatever plan you're looking to go, Advantage plan you're looking to go into. Because typically, care outside of the network is not covered except for emergencies or urgent care. An HMO requires you to have a PCP, a primary care physician, and the PCP coordinates your care. Typically, they would do referrals to other specialists if you need. Typically, the cost between an HMO and a PPO, the cost is lower, has lower premiums and out-of-pocket costs, and copays are often lower. And the focus is on preventative care. That's why it's usually $0 to go see your primary care physician. Now, a PPO is called a preferred provider organization. Typically, they will have slightly higher cost, but more flexibility. So typically, you can see any doctor or specialist in or out of network without a referral. However, if it's in network, you typically have a lower copay, and you may pay a slightly higher copay if you go out of network. Typically, the cost, the premiums, and out of pockets are a little bit higher. However, you have more flexibility. So, quick summary: HMO, lower cost, requires primary care physician, referrals, limited network. But don't think of that as too limited. Some of these plans have very, very large in network doctors and facilities. PPOs, slightly higher cost, more flexibility, no referral required, and a broader choice. Next, you hear about these things. They're called SNPs, special needs plans. And I don't want to go into a lot of detail. The one you see on TV a lot is a DSNP. That's a dual eligible plan. That's for people that are eligible for both Medicare and Medicaid. And typically, it helps coordinate and integrate these two programs. It sometimes offers special extra benefits and lower costs. There are also chronic needs plans for individuals with certain chronic needs, such as or diseases such as diabetes, heart conditions, or cancer, and they focus more on managed care for those conditions. And then an ISNP or institutional special needs plan is for individuals who live in nursing homes or similar facilities, and they structure those plans accordingly. Now, it's important to understand that you should really talk to your licensed agent about these. Sometimes these plans are great. Sometimes they're equal to or not as good as another Medicare Advantage plan that you may find that's not a special needs plan. Now, how would I begin to look at an Advantage plan? Well, I have a whole video on how to use Medicare.gov, but to find these comparisons, I went to www.medicare.gov and I selected to compare 3 Advantage plans. And that's where I would advise you to start as well. And we had talked about this whole thing about whether you're new to Medicare or you already have an Advantage plan. You actually, if you have an Advantage plan, there's something called the annual enrollment period, AEP. It's every year, October 15th through December 7th. So let's say I have an Advantage plan, or I'm on original Medicare and I want to go to an Advantage plan. During that period of time, I can pick as many Advantage plans as I want to back and forth. And then on December 7th, the last plan that I signed up for will be that plan that will be in effect January 1st of the following year. That's AEP, and it's really important because you have the ability to make a plan change at that time. Now, to sort of summarize this whole thing, if I was going to look at an Advantage plan myself, What would I do? First of all, I would make sure that my doctors and medications are covered in network. I would start with Medicare.gov. Again, I have a video on this for a baseline. Then think about the healthcare that you might need in a given year. So match your plan to your health needs. Do you have very few health needs? Are you anticipating high expensive procedures? Anticipate hospitalizations, surgeries, a lot of specialists, those types of things, and compare the plan copays to your needs. Then think about not only monthly cost, but your total cost. Because some plans have a $0 monthly premium, some have premiums. The ones with premiums may have lower copays on various procedures. Also, think about whether you want to be on an HMO, network only, or PPO for more flexibility, which may have a little bit higher cost. And I can't stress this enough, but that weird word MOOP, maximum out of pocket, I believe personally is a very important number to look at as a safeguard. What's the most I would pay out of pocket for eligible expenses in a really bad year? Then, after all that, look at the extra benefits, the over the counter. What vision and dental do I get? Do I get silver sneakers? Can I travel on this? And then the most important piece in my mind is to contact a licensed local independent Medicare health broker. Why do I say independent and local? Local because they typically know plans in your area, and then independent, they're not tied to any one carrier and they may not be biased in their selections and discussions with you. And by the way, they don't charge for this at all. They'll do an analysis with you. You do some basic research and they'll do a no charge assessment with you. So hopefully that's been a really quick primer on Advantage plans and how to select them. Thank you very, very much for your time. Hopefully, you've checked out some of the others in the series and keep tuned into this channel and messages from the Woodmiller because we will be adding to the Medicare channel as it grows. Thank you. Have a wonderful, wonderful rest of your day and week.